So what should we expect if we're going to have a sleep study? So sleep studies can be done in the hospital or in the home. I'll describe essentially what happens when you go to have a hospital sleep study. The procedures are pretty similar for home, except that instead of going to the hospital, you're actually collecting the equipment at an office usually, taking the equipment home and setting it up yourself. So one of the most important parts of having a sleep study is actually getting nice, clean, good quality signals recorded. Because once we've actually recorded the data, it's then able to be analysed. That's when I would look at it, as well as the technicians look at it. But the key is getting nice quality data to start with. To get good quality data, we need to attach the leads appropriately and also often prepare the skin by rubbing off some of the dead skin cells that can get in the way of good signals and using some electrical conducting paste to help increase the signals and get much cleaner signals. So often the leads that are used to record the EEG or brainwave activity on the scalp involve exactly that, rubbing some of the dead skin cells off the scalp, parting the hair, and then using some conducting paste and sticking electrode to the scalp. Some of the electrodes we put on the face to measure eye movements and muscle activity in the face. We may use what we call a snap-on electrode, an adhesive electrode, where we then snap on an electrode too, much like you used to when you're having an ECG or a heart recording. Also during a sleep study we measure what's happening with the heart, so there's an ECG recording. There are bands around the chest and abdomen to measure breathing, a little tube in the nose, much like what's used to give oxygen whilst people are in hospital to measure airflow, a probe on the finger to measure oxygen concentration, and some leads on the legs to measure leg movements. People are pretty wired up, and the reason to actually collect all this data is if we're looking at sleep apnea, even though one of the things we're interested in is breathing, we're really interested in what's happening to other body systems when there's a problem with breathing, because that's what really determines what I'm going to do about it, how important it is, how dangerous it is, and what type of treatments are going to be effective. So although it seems like a lot of leads, it really is important to get that integrated approach to see what all those body systems are doing during sleep. Once you're wired up for your sleep study, which can take a while, about 45 minutes on average, then it's usually a matter of just resting quietly in bed until you're ready to sleep. Then you can tell the technicians it's okay to turn the lights out and they'll start the recording. During the night, if one of the leads comes adrift, if you're in hospital, the technicians will come in and replace the lead or adjust it to make sure we get good quality recordings. In the morning around 6:30 at most hospitals, the staff will come in, take all the electrodes off, and then people can have a shower, wash the conducting paste out of their hair. That does take a bit of work, and then head off on their way to start the day. What happens after that is the technicians will look at the data and score the data according to some preset criteria, and there's actually a lot of work in that. It's very data intensive. There's about 1,000 pages of data that are manually looked through and scored, and then a sleep physician such as myself will also look at the data and develop a report together with the technicians to then use that in terms of managing people and managing their sleep problems. Often people tell me they feel that they don't sleep particularly well in the sleep laboratory, and that's pretty normal. You know, I've had plenty of sleep studies myself and often swear that I've barely slept or feel like I've had a particularly bad night. That doesn't matter so much. We're not really looking at a sleep study in terms of did someone have a good night or a bad night or a representative night's sleep. We're more looking at across the night how do all these body systems interact, and we'll get that data even if people feel like they've not slept particularly well.
For the A to Z of sleeping well, head to the Hub, sleephub.com.au.